Good evening, ladies and gentlemen. I'm Andrew Samwick, the director of the Rockefeller Center here at Dartmouth. It is my pleasure to welcome you to this evening's Brooks Family Lecture on Universal Healthcare, to be presented by Dr. Mark McClellan. The Brooks Family Lecture Series was established in 1990 by Dexter Brooks of Westport, Connecticut. Mr. Brooks graduated from Dartmouth in 1947 and the Amos Tuck School of Business in 1949. The Brooks Family Lecture Fund enables the Rockefeller Center to bring distinguished guests to campus to foster a balanced discussion of national and international issues. This evening's lecture is also the first in a series designed to commemorate the political and policy legacy of Nelson A. Rockefeller in the year that marks the 100th anniversary of his birth and the 25th anniversary of this center named in his honor. Nelson Rockefeller was a member of the class of 1930 and became one of the leading political figures of his era. His distinguished career in public service began with appointed positions in both the Truman and the Eisenhower administrations. Feeling the need to have an election mandate behind him to get anything done, he left the federal government in 1956 and ran for governor of New York in 1958. He served as governor for 14 years before serving as vice president under Gerald Ford. It was in his capacity as governor that Nelson Rockefeller made his mark in a number of policy areas that are still very relevant today and that will be featured in this Centennial Lecture Series. On the subject of healthcare, and in particular, tonight's subject of universal healthcare, he was truly a pioneer. The following is an excerpt from Joe Persico's 1982 biography of Nelson Rockefeller, appropriately titled The Imperial Rockefeller. This passage comes after a passage on his very conservative approach to welfare reform. Nelson Rockefeller was indisputably liberal on one issue, healthcare. The closest America has yet come to socialized medicine occurred briefly in New York State during his tenure as governor. In 1966, the federal government passed legislation providing medical assistance to the poor. Rockefeller seized upon the federal plan and then set a generous standard, so generous that 1 in every 4 New Yorkers was eligible for free medical care. A headline writer called the New York program Medicaid, and Washington lawmakers began to wonder what they had wrought. Rockefeller never tired of telling of a frantic call from Senator Jacob Javits. "My God, Nelson, at the rate you're going, New York State will use up all the Medicaid money that Congress appropriated for the whole country." Later, reluctantly, Nelson was forced to back down. With federal aid reduced, he had to drop more than 1 million New Yorkers formerly eligible for free medical care. He then tried for 5 years in a row to promote a state system of universal health insurance.